Thank you for staying with us. This morning, we turn our attention to a topic that affects every one of us: access to quality and affordable healthcare. As the world marks International Universal Health Coverage Day, a United Nations designated day that highlights the importance of equitable health systems, we ask an important question: how close are we to ensuring healthcare access for all? Joining us is Dr. Tunde a public health consultant, who will help us examine the current state of health coverage in Nigeria, the challenges limiting access for many citizens, and practical strategies for improving health equity. Stay with us as we unpack why inclusive healthcare matters and what steps are needed to ensure no one is left behind. Welcome to the show, Doctor.
Thank you very much.
Welcome.
You're welcome.
It's an honor to be here.
All right, let's invite our viewers to call us on 09024163440, and you can also tweet us at TVC Connect using the hashtag YourViewTVC. Dr. Tunde, how close is Nigeria really to achieving health coverage, universal health coverage?
Is that a rhetorical question?
Is it really?
Is that a rhetorical question?
We're not close at all.
I run away from all these big highfalutin phrases that the world presents. I like to domesticate issues, right?
Yeah.
But to answer that question directly, let's take it one or two steps backwards. First and foremost, what is universal health coverage, right? To start with, it's just very simply saying that everyone everywhere should be able to access healthcare without the possibility of financial ruin, right? And I think this was coined sometimes in 2015 or so, and there was a 15-year target that by 2030, that the target is that people everywhere should have access to healthcare without,
Hindrance.
without exposure to financial ruin. This 2025, almost 6, right?
Yes.
Between you and I mean, definitely we're very, very far from achieving that target. But I like all of this target things. When I was in medical school, I used to hear health for all by the year 2000.
Yes.
Then when it was almost 2000,
we moved.
Then when now, people are seeing that 2030 is a few years away. There is something they call 50 by 50. Again, that 50% of the people of the world should have some access to certain healthcare by 2050.
Yeah.
So I think it's a good question to ask. I don't know whether it's a relevant question to ask in our context, right? Of course, we are very far from achieving
What would be more
that
relevant to ask for our context?
Well, for me, really, I love to focus on things that speak to the individual.
Okay.
What is my infant mortality rate? How many babies are dying needlessly? Maternal mortality rate. How many mothers are dying needlessly? And I want to track that, all right, as a function of what we're doing. And if I want to talk about health coverage, then I want to say how many people have basic health insurance of some sort, right? I want to be able to measure quality outcomes of care, right? So those are the things that will speak to the individual. Yeah. We are able to look at indices that can tell us, okay, in 2025, 50 women out of 1,000 died from maternal-related causes. But we did ABC. In 2026, it became 45. In do
we actually do that?
Well, we have those indices, but I think that they are not given the pride of place that they ought to have, and they're not given the bites that it should have. It should be common conversation. It should be what we should hold ourselves accountable to, what we should hold our leaders accountable to, what we should hold the providers accountable to, right? Because there are two sides to this coin, right? There is the responsibility of government. There is also the responsibility of citizens, all right? If you have healthcare, do you have healthcare coverage for health insurance coverage for your house help, for your driver, for things that we all can do to sort of fill up that bucket.
Okay, I would like to know, we've over the years we've talked about brain drain in the medical space, doctors moving, doctors coming. Some people went and some people came back to say, okay, this place is the jackpadad, this place is home. But it doesn't look like we still have a lasting solution. Is there a solution to the deficit we're currently facing in the health sector as regards even infrastructure? Because doctors will continuously complain that we want to do the work, but there's no enabling environment, there's no infrastructure. And year in, year out, we see what the budget turns out as regards, oh, health sector, this is their budget. So who is doing who?
Thank you for the question. And at the risk of being unpopular,
Okay.
I am not one of those people who think that healthcare is not having enough money.
Okay.
I caught your attention
Yes,
there, right?
you did, honestly.
Okay. And I'm happy you mentioned a few things in your speech. You talked about budget, you talked about, quite a number of things. And I just want us to unpack this very simply. You started the question from health, human resource for health challenge, right? And infrastructure and all that. I think that the biggest problem we have today is not so much the amount of money we're spending, but where we are spending it and how we are spending it. I'll explain in a moment. One silver bullet that I think will recalibrate the health sector, if the people who drive the health space have the courage to take that decision, is in healthcare, they talk about the demand side and the supply side. Demand side is just simply you and I that buy the healthcare. And the supply side is the people that provide the care. Today, when people want to intervene in healthcare, they want to build new hospitals. They want to buy equipment. When you pour water into a basket, no matter how much water you pour, it's going to drain out, right? Now, just follow me with simple arithmetic.
Okay.
There are two nations in this country that I think can lead the way. The sovereign nation itself, Nigeria, and Lagos State, who I almost believe is also almost a sovereign, right? And Nigeria's spend on healthcare, budget for 2025 is probably somewhere around 2.5 trillion, something like that. Lagos State is around 250 billion, something like that. Now, if by some magic somebody decides that rather than take that money to put in hospitals, right, or to pay salaries, or to whatever it is, that the social contract that the government has with the people is to give them healthcare, right? And I take that 2.5 trillion and I say I have 200, or let me say 250 million Nigerians. At 250 million Nigerians, rather than use that money on the supply side, I put it into a health insurance bucket, right? Which simply means at the same current spend, I have per capita that I can use to pay for healthcare for every Nigerian today. I'm not asking for additional spend. If Lagos State,
in a different place.
Yes, I just take the money from supply side to the demand side, right? And I intervene in the demand side, right, rather than on the supply side, because my guess is that TVC probably has health insurance for its people, right? You don't really care how you go to a hospital. TVC buys you health insurance.
Yes.
You go to the hospital and you get care. If you have a problem with the care, you go to the next facility or you raise issues with it, etc. The truth of the matter is, if we want to release capital into health sector, private capital should deal with the supply side, while public capital should create a social contract for the people on the demand side. 250 billion spend of Lagos State would also provide a per capita of about 10,000 for every Lagosian. It means Lagos State has today a health insurance. I think they've raised the cost, but they have a health insurance about 8 to 10,000 or something like that, which means today his own health insurance, if he just decides that, private sector deal with the supply side, I as the regulator, I'll regulate what you do, I ensure quality, but I'll pay for every Lagosian. You'll suddenly see that there's a lot that will change, because there's now a lot of money that is
guarantee
available. Yes,
of
of
the demand.
The doctors will run back.
Yes.
Because there is now money in that space,
Yes.
right? You won't need to beg people to put money into that space. You won't need to beg people to come back, into that space.
Okay, so
Go on.
okay, thank you. When we talk about public health, I like the train of conversation that what you've given to us as an option, but I feel like our government don't measure the data of the impact of poor health coverage and the power of preventive care, which is where most public health concerns should be domiciled. I've seen some countries that go on a drive of zero sugar because they want to prevent diabetes, or increasing fitness because they want to prevent heart issues. How do you think? What do you think is the main problem with poor health coverage, and how can we address it without, like we said, we don't have enough money in the context of building facility? How can we address improving health coverage for Nigerians as it is right now?
Well, I hope I understand your question. If I have the capacity today, is that one single silver bullet that I'll do. But I'll speak to preventive healthcare. You see, what happens is when you invest in the individual, right, by providing health insurance, and our laws have changed, though, we can talk about that. The governments are breaking the law, so to speak, because health insurance is meant, both us and the government, right? Health insurance is meant to be compulsory for everybody. Now, when you do that, for a resource-constrained environment like ours, people will suggest that you could do something like a capitation-based model, which means that for every facility, let's say you have 10,000, you have 20,000 people that you can take care of. Now, because it's a business that you are now doing, you are forced to ensure that rather than treat somebody for malaria that will cost you maybe, I don't know, 5,000 or 10,000. Your job as the healthcare provider is to ensure that that person
does not have
sleeps
malaria
under insecticide treatment, doesn't have malaria. There is health education, health promotion, and all of those kind of things that would ensure that rather than have a stroke, you manage your diet, you manage your blood pressure if you do have one. Like the sugar that you mentioned, you manage your diet so that you do not come down with diabetes. If you have the diabetes, you manage it and you are compliant with your drugs so you don't come down with diabetic coma and diabetic complication. So naturally, it will be a business decision for the providers in the space if indeed we have a robust, transparent, corruption-free system that ensures that there is enough money. Anyways, we are spending the money today, but we are spending it buying diesel, paying doctors who will go on strike. I hope my colleagues are not going to shoot me now, and all of that. So I think we can't be bold and brave enough to create a transition. Yes.
Yeah, because I was going to talk about, because I know Lagos State actually do the demand side, because they have this insurance that they do, and I know. But the problem with this, because I know Lagos State must be pumping money into it, is when you go to the hospitals that are under that, 9 times out of 10, when you go, you just give you Panadol. Go. We can't
so
do
the quality of.
We can't. No,
you don't get full coverage.
Your sickness is more than your insurance. Go.
Yeah.
So, because I do it for my staff, I end up going to other hospitals that will actually treat.
Okay. All right. Well, thank you very much for bringing that up, because I'm very excited about what you have said. It's actually a good example that things can work.
Okay.
And I do hope my people in Lashma are listening, the agency that is happening to this, because if you have a complaint, they have a system. If you have a complaint, right, they have a system where you can raise the complaints and all of that. I'm pretty excited because 5 or 6 years ago, that's why I said 2 nations, and I mentioned Lagos, because I think Lagos is a trailblazer, right? There is just the need to give it a little bit more energy. About five years ago, I was opportuned, the organization that I work for, I was actually opportuned to support Lagos State in advisory capacity. And that was where Ilera Eco was crafted. It was actually crafted on my dining table, right? Wow. All right, that's where Ilera Eco was crafted and all of that. But then there were like 10,000 people on the scheme. Today there are about 1.5 million people. Now, there are different levels. For me, that is a significant leap. and a significant progress. Right? Though 1.5 million out of 25 million people is still very tiny. That's number one. Lagos State has a law, that the Equity Fund law, which was also one was opportune to see how it played out, which says that the government should, I think it's 1% or 2% of their consolidated revenue goes into an equity fund that is supposed to pay for the poorest people in Lagos State. I was shocked when we did that work. 68% of Lagosians were said to be poor.
Wow.
Now, I felt that the figure was so high. I had to call for the data. It was, I think, a UNICEF sponsored. I had to call for the raw data. I wanted to see their methodology because the strategies we were going to craft was based on the data that we had. Guess what? As at that time that we did a quick check, it was 71%, right? We don't know what it is. So, what is my point? You speak to access.
Yes.
You now speak to quality. First and foremost,
Access.
our problem, yes, let us even have access. Now, if we now have a lot more activity happening in that space, we have a lot more people in that space, then we'll go to the second level. And when there is enough in that pot, you will find out that quality becomes an issue. And Lagos State really is trying, really, because they have a farmer, right? Which is another agency that is kicking people in the backside. Kicking providers in the backside to ensure that they live up to certain standards of quality. I think what we all need to do is to sit in, understand this, and make conversations and demands on our people. If that money, if we had a lot more people on that scheme, and the law demands that everybody needs to be on it. That's actually the law at the national level and also at Lagos State. If we have a lot more people with time, when there is more people, yes, at least we'll say, okay, we now have coverage. Then the question will now be, what is that coverage? What is the quality of that coverage, right? So, I mean, that we are saying that in Lagos State today, for me, is a sign that we're making progress, right? Because they have somewhere to go. You are just not happy. Prior to now, that was not so.
I mean, when you talk about Lagos State, as you said, the trailblazing state. But then I'm thinking of the rest of Nigeria. You know, it's important really that we put resources to the demand side. But we have places like in the far north or different places like that where it's so hard to find a primary healthcare center, you know, in those communities. So, and fact, private, and then it's not so profitable for private companies to go and provide those right now, and so it's government that still has to secure all sorts of reasons. So you still find government having to do that in those areas. And I'm just, you know, with this robust conversation we've had today, I just feel that we're also talking to the rest of Nigeria, that there are things that we can learn and do, you know, in our different places.
They can learn from Lagos. Understanding
that we have our own unique challenges. Thank you for joining us today, Dr. Tunde.
I wish I had half a second to respond to
half a second. If you can give me half a second.
Yes, I'll give you. Okay. Truth be told, the issue is not that there are not enough facilities. As policy advisor to the former vice president, I discovered that we had close to 30,000 centers. Right? So the issue is not that these facilities don't exist, but the interventions are not the accurate, correct ones.
Thank you again, Dr. Aye. Thank you to our viewers. Thank you, ladies, for a fantastic conversation, and to our viewers. Yes, and our viewers, we love you to join us again tomorrow for another interesting show. Have a wonderful day. Bye for now.
So